What really made me join South East London Healthy Living Programme were a few things coming together. When going to the GP, I'd been diagnosed with sleep apnea. I was also pre-diabetic and with high cholesterol. So that, together with my high blood pressure, now meant that there were serious health conditions. So serious that I was in danger of something really serious happening to me. And then I kind of contemplated the whole thing like one does, about life expectancy and about other serious illnesses. This was a situation and a condition that I had some control over. I had the ability to be able to do something about my health and about my life expectancy. And so once seen like that, that's all the motivation I needed, really. I guess as an adult, I just recognised and took on rules and laws and habits for myself that just were not helpful. Through the program, I was able to learn about nutrition in a much better way to help me understand that I could change those bad habits into good ones. So on one of those sessions, we had a session where we looked at the Eat Well plate. I'd observed that all of the correct food groups were there, but the foods that I had often eaten were not. They were off to the side, so cakes, crisps, fizzy drinks and what have you. And I simply asked the question, well, why are those things not on the plate when I eat those all the time, when they're part of my normal diet? And it was explained to me, well, whilst you might be eating those things, everything on the plate is what you need to live. You don't need those things to live. Well, that was pretty mind-blowing to me, to be honest with you. I would have considered myself a sedentary person, not somebody active at all. In fact, one of the things I always joke about is that I would drive to my car if I could. I would not one for physical activity at all. So I wasn't really looking forward to the physio sessions. And that first one that we did using those nostalgic tunes and what have you was so much fun. I didn't realise that exercise could be fun. I didn't relate the two things. And so it was pretty mind-blowing to me to recognise that you could work really hard with your body but be just having a great time. It's not something I've been able to say since I was in my 20s. I like getting around, I like moving. It's an important part of who I am now. I couldn't give it any more recommendation for everybody that's struggling with their weight. I've learned that I'm an active person and that I can make small changes that turn into large ones. I didn't really know that about myself before that.